Did you know that 56% of Americans use their employer-offered health insurance? What happens when you no longer have that job? Hi guys, welcome to Think Say Retire, where we chat about all things personal finance, investing, and early retirement. Make sure to give this video a thumbs up if you like it and subscribe so you don't miss any tips from TSR in the future. So I'm recording this video in 2020 when arguably more than ever before, knowing that you can go to the doctor without being charged a full month's paycheck or more is at the top of people's minds. Healthcare is one of those things that you just simply need. No matter how healthy you are, at some point you'll need to go visit a doctor. So having access is crucial. If you're like most people who will retire at 65, you will most likely be eligible for Medicare. But if you've ended up on Think Save Retire's page, I can assume that you're not like most people. In fact, you probably live outside of the box and you're planning to retire long before you get wrinkles. What the heck can you do to make sure that you're covered? This is one of the biggest questions that I had when I first started hearing about FIRE and getting into the movement. But just like they no longer need a paycheck to survive, they also don't need their employer for health insurance. Steve Adcock, the original voice of Think Save Retire, shared what him and his wife do as early retirees. Steve, who retired at 35, uses Liberty Healthshare. He and his wife are also full-time RVers. He says, it enables us to maintain our mobile lifestyle with health protections at a reasonable cost. It also lets us avoid the whole Affordable Care Act and open enrollment thing and the uncertainty around what it might look like down the road. So just to be clear, the most important thing to note about health shares is that they are entirely different than traditional healthcare that you're used to. More or less, it is a group of relatively healthy people who are sharing medical costs. Monthly dues for healthcare coverage are all pooled together and collectively fund the healthcare costs of those who are members of the health share. Liberty Healthshare, which like most health shares, is a nonprofit organization, which means revenue is not the predominant factor in health services for its members. However, they aren't required to cover medical expenses either. We go into further detail regarding eligible medical bills and coverage guidelines in the article below. While health share programs can be a lot cheaper and typically more flexible than normal health insurance programs, they are certainly not for everybody. To read more about Liberty Healthshare, the drawbacks, and the perks, make sure to check out the article below to get a full picture of how well it works for this early retiree. Of course, this is what worked for two of our favorite digital nomads, but what are your plans for healthcare in early retirement? Is this something that has been holding you back from joining the financial independence movement? Share in the comments below. If you like this video, please be sure to give it a thumbs up. Don't forget to subscribe so you don't miss any tips from Think Save Retire in the future.